Thank you everyone for being here. I think last time I spoke at a conference, it was the second last speech on the last day, and there was about 4 colleagues and 2 people at the talk. It's fantastic to see a room full. Thank you for coming. I want to sort of carry on a little bit from Dr. Padge's talk, really, and talk about pain relief as it stands at the moment in Australian cattle production systems, and a little bit of a thought about where to from here, and probably one of the things I think that we haven't thought so much about in terms of pain relief. I agree with Dr. Padger that coming up with ways of addressing pain at the time of the procedure is very important. I'll talk more about that in a minute. But the longer term pain relief, and if you've ever been to hospital and had surgery yourself, I'm pretty sure you don't just take 1 dose of pain relief after the surgery and then forget about it. And that's another thing I want to talk about today. What do we do in Australia to our cattle? We do a number of things, and I'm sure that many of you are familiar with these. Things like identification by ear notching and tagging, branding, castration, of course, very popular and very common procedure, dehorning and disbudding, again, and in our female cattle, particularly in our extensive northern beef production systems, spaying is something that's very important. I won't talk too much about spaying because my colleague, Dr. Dominique van der Sarg, is going to talk about that in the next talk. But we all have a rough idea of what these procedures are for and what the purpose of them is, I'm sure, so I won't sort of talk too much about that. But they are necessary procedures, especially for extensive production systems where animals are out free roaming most of the time, and we can't have bulls roaming free to an extent, and castration and dehorning, disbudding, very important procedures. But of course, we know that those procedures are painful. We know that, as Dr. Padger said, we know they're painful. We know animals feel pain. And it's really a situation where, from my experience, I would say 99.9% of the animal producers that I've spoken to and met with don't like to cause pain to their animals and do want to do something positive about improving animal welfare. In Australia at the moment, we have a set of government standards and guidelines, welfare standards and guidelines that have been instituted nationwide. These cover different species and set out the minimum welfare requirements for the different animal production systems. All of those standards and guidelines recommend pain relief be used with painful husbandry procedures, but none of it is mandated in Australia. And one of the great threats that's recognised by the producer bodies in Australia, groups like Meat and Livestock Australia and Australian Wool Innovation, one of the great threats to the industries is growing consumer awareness of these painful procedures and the impact that has on consumers wanting to buy products. That's seen as a great threat in Australia because consumers are starting to see that animals are treated, given these painful procedures without pain relief. And I guess most people try to compare that back to their dog or their cat that might go to be castrated or spayed at the veterinary hospital and are treated very much like a human patient would be treated. Why don't we do that with our extensive animal production systems? Basically, it would be totally unviable and uneconomical and just would not work in an Australian setting, at least. Some of these issues, of course, will be addressed longer term, things like dehorning, and there's already a big push in Australia to try and breed out horns, particularly in our northern extensive cattle, but that's going to take some time for that to happen. And in the interim, we still need to be dehorning and disbudding animals in those production systems. I guess thinking a little bit more about what we need in an Australian setting and what to some extent we already have, and I'll talk more about that in a minute, for an effective pain relief option to be applied to these extensive systems, it's really got to satisfy the 4 criteria that I've got here. First of all, it's got to work. It's got to do something useful. It's got to reduce pain in some way. It's got to be safe, both for the animal and for the user or the person that's actually applying and using the pain relief. So whatever it is, it's got to be something that's reasonably safe, maybe difficult to overdose or give the wrong dose to, and safe if it comes in contact with skin and so on. It really needs to be something that can be applied with someone with a low level of skill, preferably a farm worker and not a veterinarian, because that then allows farmers to be able to use the product themselves without having to expend the cost on veterinary help. And it has to be to a reasonable level cost effective, because farmers are willing to spend money, and the experience in Australia is that they do spend money on pain relief, but there has to be a reasonable limit as to how much they need to spend. So if we can satisfy those conditions, we have a better hope of getting something that will be taken up by producers and hopefully will be used much more commonly. Whoops, sorry. So we've got several options that are available in Australia at the moment, and we've done a lot of work with these different products in our group at Sydney Uni, looking at multimodal and individual use of a lot of these products. Probably the first option, the one that is available, most likely with the use of veterinary help, because it does require some skill, is the use of local anaesthetic agents, as we saw with Ed's videos there of the disbudding of the calves with some local anaesthetic and some corneal nerve blocks. And again, it takes some expertise and experience and skill to do that, so we don't normally expect farmers to do that. There are some programs in some parts of the world for things like velveting deers, where animal producers are actually trained to do one type of nerve block and then be able to velvet deer. But in an Australian setting, again, for cattle, that would probably be something that would be a little bit above the expectation of most producers. The other thing that we can do in Australia is use, there are a number of approved non-steroidal anti-inflammatory drugs that can be injected into our cattle. And those drugs, again, although providing some very effective pain relief, it's something that takes time to have effect, and it's not really preventing nociception from occurring in these animals, rather than preventing that inflammatory soup that develops at the sign of a wound or trauma, and preventing the pain that was a result of that inflammation. One of the big things that's happened in Australia in recent years is the development and the uptake of the topical anaesthetic trisulfan, and Dominic is going to talk more about this in a little while, so I won't mention too much about trisulfan. It's a mixture of local anaesthetics, lignocaine and bupivacaine, and some adrenaline and cetramide. It's in a gel base and it's sprayed onto wounds, and what we found is that the gel base forms almost like a plastic skin or a bandage over the wound, which we think also has a beneficial effect on healing, although we need to do some more work on that. This product was originally developed for the wool industry, for the mulesing problem, which you may or may not have heard about in Australia, and it's had a huge uptake by wool producers. It was then, first of all, registered for mulesing only, then it was registered for castration and tail docking in sheep. Now it's been registered for castration, dehorning and disbudding in cattle. It's very easy to apply by farm workers. They just need to spray it on. It has a very rapid effect from what we found in our studies, and a reasonable duration of action, and up 6 to 12 hours where we've done studies that long, we're still finding some analgesic effect from that. And we think, like we said, that potentially the gel base may be providing some beneficial protection to wounds and providing some help. But of course, the problem with this product is that it's applied after the procedure, very rapid in onset, but still not quite addressing the problem of the pain of the procedure itself, as Ed was saying before. This is just a couple of images here, one of a castration wound being injected with some trisulfan up the top, and down the bottom some being sprayed on some dehorning wounds. We've also got use of an orally applied non-steroidal meloxicam drug called buckalgesic in Australia, made by Ilium Troy. This is something that, again, is probably equivalent to an injected non-steroidal anti-inflammatory. The problem here is that it's recommended to give this drug up to 30 minutes before the procedure, so that would mean double handling if you were to do it correctly. We found it to be helpful and to provide some pain relief, but doesn't seem to have quite the uptake in Australia of trisulfan at the moment. What else we've done is used coolant sprays to try and address some of the procedural pain options or procedures. And we found that a hydrocarbon-based vapor coolant spray that's highly volatile and evaporates very quickly will cool the skin enough, and we've got to get the skin below 10 degrees Celsius to inhibit nerve conduction, will cool the skin enough to prevent that nociception from travelling, and it lasts for about 10 to 20 seconds. We found that it works best on ears because ears are very thin and very easy to cool. Didn't work so well on tissues like scrotum, too thick and heated up too quickly after the spray. But we found that in things like ear notching and ear tagging, very effective. This graph is a little bit not quite so self-explanatory, but the black sections, I guess, on those bars are severe responses. The whiter colour are the less severe responses, and you can see for the ear tagging, VS, the vapor coolant spray, very little severe response compared to the water spray. WS was just a water spray that we used as our placebo. So we have published on that, and we've done the same with piglets, and it worked just as well in piglets. And I keep pressing the button twice, my apologies. We've tried some multimodal pain relief because if we're going to think about trying to address pain the best way possible in human and small animal medicine, we always use multimodal pain relief, and it seems to work best in terms of providing a number of different ways of addressing either pain production or pain transmission. And we've used both our topical anaesthetics and our buccal meloxicam treatments and found that they work quite well together and do provide some reasonable pain reduction in the first 6 hours at least. And we also found that in one study, there was a definite benefit in weight gain from the animals that were treated with both. However, we did do another study which involved, that first study involved castration and dehorning. This study was just castration. We found that there was actually no weight differences in this particular study, but there was benefit and reduced inflammation 2 days following the procedure for those animals that were treated with the meloxicam. So definitely some benefit from that. But really, if we're going to, and I don't know why this keeps jumping 2 slides. If we're going to really think about pain relief, I guess we need to think about those things that Ed mentioned and that are really quite logical, and that is that we currently do have nothing that farmers can use that will address pain relief during a procedure. And you know, this is the thing that probably is going to continue to raise consumer concern, and in that way continue to pose some sort of threat to the viability of some industries as more and more people decide they're going to become vegetarian or vegans. The other thing is that most of the treatments we look at, we've only looked at for 6, 12 hours, maybe 24 in some studies. How long do we need to provide analgesia for? And as I said before, if you go to hospital yourself and have surgery, you'll be sent home with pain relief for several days because the pain from that procedure will probably continue for several days. And we probably need to think the same sort of thing with castration and dehorning in our cattle, that if we're going to do these procedures, we probably need to be thinking more longer term about what we can do to provide suitable pain relief. So what we're starting to do at Sydney at the moment is look at a long-acting formulation of non-steroidal anti-inflammatory, one-off dose that will last several days, and we're doing that primarily using a polymer that's in an organic solvent. When you inject it, it becomes like a little implant and slowly releases the drug over a period of time. So far, we've trialled a couple of different formulations. The last one we trialled, you can see we got about 110 hours above what we think is the therapeutic level of meloxicam in our cattle. We're using the 0.2 micrograms per mil as the level that was based on some earlier work by Toutain. And this particular formulation we're about to test again, only this time we're going to actually look at pain responses over that period of time to see if it actually is providing analgesia at that particular level. So there's some promise that we may have this single dose long-acting formulation that we might be able to use that will give some days pain relief to our animals. I guess in conclusion, just very quickly, and I think I'm just about out of time, the pain relief options that we currently have are very good and are being taken up by producers at a very, very high rate. There's a lot of producers that are very happy that they now have access to things like trisulfan. These procedural pain issues are something that we really need to think about, how we can effectively provide pain relief at the time of the procedure, but in a way that's cost effective to the farmer and preferably done by the farmer themselves. And it's probably a good idea to think about the concept of self-medication. And Arthur Webster, the founder of the 5 Freedoms, basically says that self-selection for medication is the best way to tell whether an animal is receiving adequate pain relief from that medication, but that's something that's going to require a little bit more work and a lot more thought in the future. So I'd like to thank Bayer and MLA, who helped us with a lot of this work, and Sydney Uni, of course, and my colleagues. And I'd like to thank you for being here and listening. Thank you.
Thank you very much.